and welcome to this issue of Pointcounterpoint. We are here with a subject of significance. We are not tracing any breaking news story, nor are we looking at scams. We are not after any politician, nor are we discussing elections. But we are, again, as we repeatedly say, as I repeatedly say in this show, that sometimes we need to address elephants in our rooms. And this is a discussion that involves all of us, affects all of us, affects our families and friends. And the world around us has this little elephant which we must take care of. See, often before I introduce our esteemed panelists, I'd like to say this, that when people kind of meet us, we wish them good luck, we wish them Godspeed. When they're traveling, we tell them, all the best, may your journey be good. We wish them success, we wish them luck. But how many times do we ask or say, we wish you happiness? And we wish you, and that is something that's important in this context of this discussion, because being happy is a state of mind. It's not always about how you feel, how you look, whether you're smiling or not. And this leads to the subject which we are going to address today, and it's going to be a complicated subject. It's a subject about your mental well-being. We call it mental health, but I would say mental wealth-being. And whether your soul is happy, whether your insides are happy or not, whether you are in a state of mind to take on the world and be confident. Then there are different reasons which may lead you to a state where you feel that enough is enough. And we have this phrase called pulling the plug. So many of us in this world pull the plug, as it were, the plug of life. We do it deliberately. We do it sometimes with full knowledge. At times we do it in spur of the moment. But mental health and suicides is a very, very complex issue. And we are here. That is the reason we have probably the best and most knowledgeable and esteemed panel that we could have had. On the 10th of September, we are shooting on the 9th of September. 10th of September, which is tomorrow, is the Suicide Prevention Day, which will lead up to the World Mental Health Day on the 10th of October. And this is as good a time as any to speak about this. But let us not forget that mental health and suicides is something that we need to think about each possible day, because the next victim, God forbid, it shouldn't happen, but the next victim could be somebody who's very close to you. I'll introduce the very esteemed panel, and I thank each one of them for having the sensitivity to respond to this call and come and be here. Dr. Peter Castellano, very renowned psychiatrist and director of COOJ, the Mental Health Foundation, the premier one in Goa, doing phenomenal work. Dr. Gaurav Haldankar, welcome. He is an ex-senior resident of the IPHP, Institute of Psychiatric and Human Behavior, and is a consultant psychiatrist and associated with Setu, which of course is doing a lot of work in dealing with issues like this and allied issues. Miriam Sequeira, welcome. She's a psychologist of Sangat, and Sangat, of course, is again a mental health research organization, again in the field of research and finding solutions to this very complex issue. Dr. Tanvi Pednekar is a consultant. She's a psychiatrist and with the North Goa District Hospital under the mental health program. Dr. Tanvi, welcome. And last, again, we would like to welcome back Roland Martins, the coordinator of Goa Can, and in many ways the inspiration behind this Pointcounterpoint, because it was he who said we must do this, and we'll begin by asking him to set the ball rolling and essentially kind of respond a bit to what I've said and to lay the grounds for this discussion.
Thank you, Sujay, and I'm really pleased that we have a panel discussion today, because if we are really going to address this issue, media has a major big role, and I'm happy that this discussion is possible. Over the years in Goa Can, we've been finding that people have discussions on problems, but when it comes to solutions, there's always the finger pointing and blaming someone, the other, government, non-government. And thanks to Kuj, we felt that we must join hands with Kuj and try and bring this issue in public knowledge in that sense, because we found when we were going to panchayats, we were talking to people from the consumer clubs, gram sabhas, there was this concern, but they were unaware of to the extent of the problem and what is the solution. Now, the first thing was to petition government. So, 2-3 occasions we wrote to the Directorate of Health Services saying, set up a task force, you need to assist NGOs, but we need to address this problem. But then we found that, still the lot of the incidents that were being reported in the media were not getting across to people. Then we started a mailing list called Goa Suicide Watch. And we started sharing just the facts of, what has been happening.
Right.
And then we found that, okay, people are interested and they need to set the ball rolling now.
Right.
Importantly here is, we have got many stakeholders, many agencies. For example, the Directorate of Health Services funds a village health, sanitation and nutrition committee in every panchayat. The problem here is people look at health as, fever, malaria, dengue, and would not look at mental health as an
Right.
issue.
Right.
So we thought, okay, now is the time that if we can take this up and broaden the scope and look at various stakeholders intervening.
Okay, we'll come back to it. Dr. Tanvi, if you could begin by just telling our viewers as to why does Goa have so many suicides, in the sense that suicide rate is going up. And if you permit me, I will just read off the total number of cases. In 2017, there were 266. In 2018, 249. In 2019, 259. In 2020, 303. 2021, 311. And in 2022, up to June, we already have 150. If we only look at these simple statistics, we see that the number of suicides are not going down. Could you kind of point to a larger reason for this trend?
Regarding the suicides that are increasing in Goa, we cannot point to one thing actually if we go to see. We cannot point to one certain thing, because suicide itself is a multifactorial thing. There are a lot of factors that are involved, and one of the factors is even the stigma, like how Sir said, like most of them are aware, as he said, like for them it is like more of physical health, that is fever, malaria, that. So even if a simple question that is asked, how are you? How many of us really think about mental health? What we think is basically the physical health. We are not thinking about mental health. That stigma is still there in the community. Along with that, there are a lot of other factors, like that of societal pressures, then there is family factors, the illnesses. There are a lot of factors that contribute together. But if we talk about Goa, we can speak about maybe substance abuse as one of the factors which is there. Along with that, unemployment is one of the factors. During the COVID pandemic, there was a lot of problem regarding this. Like Goa is a tourism driven state.
Right.
So at that point of time, there were a lot of unemployment that basically came up during that time. And COVID pandemic itself was a major factor that made people isolated, made people, the social connectedness was somewhere lost at that point of time. So there were a lot of factors which are, I think, responsible for this increase in the suicide rate in Goa.
And you've correlated COVID to this a lot during that period.
Yes, during that pandemic period.
Okay. Miriam, if you could just, she's mentioned a few points. If you could just kind of elaborate on them a little bit, and also share with us the kind of people who are coming with these kind of problems. Firstly, do you need to go out and seek them, or is it voluntary? That also, shows whether people are willing to come forward or not. So, as in your experience as a professional in Sangat, if you can just share with us.
Sure. Happy to share the anecdotal evidence that we have, but the key point I want to make is that we can't fully answer that question that you're asking, what causes these suicides, because of the lack of comprehensive data. Now the data that we have to go off is the NCRB data. It is collected by police officers in the, typically a constable.
That's right.
and we don't even know, so there isn't a mental health professional there or anyone trained to do a psychological autopsy. So definitely that is a conservative estimate, first of all. Secondly, we are
Can you
not...
just elaborate on what a psychological autopsy is? Very interesting phase.
Sure.
People would love to know.
So what we need to ask is interview all of the family members before this person died. What was their behavior like? Were there any changes? Interview the neighbors, anyone who was close to this person, to identify if there were anything that could indicate suicide. Even if you look at the NCRB data,
Right.
there are a lot of instances where if they don't know the direct cause, say unemployment or family problems like they've said, they put it under others, right? Or there are many instances where there are these unnatural deaths reported as accidental deaths. So there are a lot of gaps even in that data. So the first point I want to make is, in order to answer this question that you're asking comprehensively, accurately, we need better data collection and reporting, because we need to know exactly this, that what is causing people to end their lives. It is a very complex issue. What we do know from the data that we do have,
Right.
especially about Goa,
Right.
is that suicide is the highest, the number one cause of death among the population of 15 to 39. So we know that young people are really dying by suicide here, at least in that category. This is 15%.
Yeah, I wanted
of
to ask you that question actually once. Good you spoke to that. Okay.
And there are various reasons for that, like she said, for example, alcoholism. And the studies show that people who are intoxicated are 3 times more likely to attempt suicide. It increases the risk factor. Especially adolescents, if they are using alcohol, then they have a higher risk of attempting suicide.
Right.
So alcohol is definitely one. And another point I want to highlight is how we look at suicide as a mental health problem. And testimony to that is that most of us here are mental health professionals. But in fact, at least in India, it isn't entirely a mental health problem, because almost 50% of the cases in India are for other issues like social, cultural, issues around not being able to choose their romantic partner or the person they want to be with, or not being able to choose their career that they want
This
to.
is emerged out of cases that you studied.
Exactly.
Yeah,
So in India, we need to also look at suicides from that lens of the social, the cultural, the political aspects. There are a lot of other issues that also come in, but we can elaborate more on that as we go along.
Yeah. Dr. Gorafi, the thing is, Goa is generally known to be a place where tensions are less, and the world is more beautiful, and there's relative peace and quiet, and other allied tensions that are there in the metros. For instance, your traffic, your jobs, your other stuff are taken out. And the irony here is that people actually come to Goa to relax. So the supreme irony is that in a place where you actually come here to relax is throwing up data which is completely shocking. I mean, for instance, if you look at the rate of suicides in states and UTs in 2021, Goa ranks around the 6th with an average of 19.9 per lakh, which is way above the national average of 12 per lakh. Could you just kind of put a finger to this, if you can?
Yes, as previously mentioned, Goa is a place where other people, the other states come to relax. But where do Goans go to relax? Are these places which we call bars, or local hangouts, or is it more social connectedness? Or where do the youngsters go? Okay, are they only discs, or are there other socially appropriate places where people can come together as a community, share ideas, share their difficulties. Nowadays we see mostly the youth, or they mostly went out on social media.
That's right.
Now that has to do a lot of has to do with post-pandemic, how we view the world. We usually sit in our houses, and we we have stopped discussing matters in a social setting, in face-to-face
That's
setting.
very important, correct.
And yes.
Yes.
And that really restricts our means of expression in one, and then we are also through sometimes interacting through social media, we get a lot of information which may not be very appropriate. It's one-to-one, and there's a lot of rise in cyber suicides, as we call it.
Just could you elaborate on that?
Cyber suicides, as in certain suicidal ideations. Okay, if you just if a person is going through certain thoughts, he's always on the ambivalent phase, right? And there's always a sense of ambivalence whether to do it or not to do it. And when you search the net, if you even type the search word suicide, what you will get now, it's a very good thing that we get helplines. Deeper into the matter, these restricted searches have to be very fine-tuned, because what the mind wants, it gets out of somewhere, and the internet is a host of, the knowledge is huge, and if you are tuned towards searching for negative outcomes, you will get those outcomes. So you have to widen your social horizons, widen a social network, so as to get a lot of various spectrum of views from other people, so that you widen your horizon, as to the outlook. So that is, I think so, the restricted means of access to social networking may be a cause of worry in the recent times what Goa has.
Dr. Castellano has been listening to us very patiently. Before I get into a specific question, see, you were one of the pioneers in setting up this, the whole mental health movement, and it's not been now; it's been over a period of time. So you were somebody who caught this issue early. So if you can just take us back and share with us and our viewers as to why you decided, or you had this whole calling to first address this, because that itself is very important, because you got into this space, if you can call it a space before many other people did. So if you could just tell me about your own personal experience and what led to you getting into this, it'll be a very nice anecdote to share.
So thank you for that question, because it brings back a flood of memories.
Yes.
But for me, how it started off is the journey of setting up the suicide prevention program in Goa was actually, I worked with a lot of youth, a lot of young people. And
how did that happen? I mean,
that was more on my personal space, part of groups that I was associated with. And as I started talking to them, what I realized is that they did not have a confidential or safe space where they could express themselves. And at that time, going to there weren't counselors, they were expensive. No one would actually go to a psychiatrist to talk about basic issues with your relationship. And so where would they talk? And that's after just talking to them, and we realized that there was this great need to set up a kind of a helpline. As we went digging deeper and deeper, we realized that these same young people, many of them actually had suicidal thoughts themselves. And initially they were very apprehensive to share this, but as we started just making them feel more comfortable, those thoughts started coming out.
But did you put a finger on the pulse to see why?
And that's so that's how it's like very organically, very fluidly. It wasn't like bang suicide prevention.
Right.
And so we decided, let's have one day, just one day, 10th September, to observe World Suicide Prevention Day. And then we realized this one day is not sufficient, because there's so much that needs to be done. So one day became 1 week. And in that 1 week, we collected a lot of information at the grassroots level, where we went to various schools and colleges, and we were talking to people.
Proper volunteer force to do this? As it built up?
So it started off with just myself and one person, and that person is basically a singer by profession, but she was a volunteer. So we just started this. And then we got in people who faced challenges in life to come and speak to the youth, because we felt that youth would kind of relate more with them rather than with us being professionals. And that's where we felt the pulse. We felt the need. We felt that here is where we need to tackle the problem. And one thing very interesting, and for me it's a huge change, is that initially when we went to colleges and said, can we have this program on suicide prevention? All colleges said yes, but please do not use the word suicide. Because if you use the word suicide, you'll be planting an idea in people's minds. And that was the huge stigma and ignorance that many of the educationists actually had. For me, it's a change, because today, 10 years later, people are inviting us and saying, let's have a suicide prevention program. Colleges are having suicide prevention programs. Media houses are having discussions like this.
So the word is out of the closet.
It's out of the closet. And initially, to kind of make it a little bit more receptive, we had to use various means. We got in singers, we got in musicians, we had public programs. I tell you, we got some Norwegians, 27 Norwegian girls who actually pulled in the crowd to come in for a suicide prevention program. Otherwise, they would never have come in. So we used various tactics, and it all worked. We had flash mobs in the markets, we had street plays, we had competitions, we had like a lot of stuff. So today, what I feel is we have reached a level where there is awareness, that people are aware that suicide is a problem. But we're getting stuck over there, because to take the movement ahead, we need the networks to come in. We need all the participants in this journey to actually join hands together to take the movement of suicide prevention ahead.
Okay. I'll do one more round starting from you and ending before you take the break. Peter, if you could just tell us a little bit more in the sense that, if we ask you to deduce the which are acting as a trigger, is it loneliness? Is it the breaking down of families and from joint families to nuclear families? Are you missing the confidence of peers and a greater group, or is social interaction getting more from human to digital? Are these all a culmination of factors?
Everything.
Okay.
And as I think everyone has mentioned, you cannot pinpoint a singular reason, because it is multifactorial, and all these reasons contribute. Besides these reasons, there are many other reasons that also come in. Like during the pandemic, many of the young people who naturally would have de-stressed in the open environment could not. They were stuck at home, and they were forced to face their issues at home, and they could not. So many young people actually ended their life because they did not have that outlet. Domestic violence increased at home. That increased suicides. So again, the pandemic brought in its own relevance.
Right.
Then, if you look at, as she mentioned, the difference between the West and in India. In India, you see a lot more suicides are impulsive suicides also. And one of the reasons is because the access to means are easily available. You see, in the West, you want to jump off the bridge has got railings. Yeah, it's different.
Yeah, we'll get into these.
But that
these
is
deterrents
also
which are there.
That is also one of the reasons why suicide rates could be higher, and for the kind of data that we get and the kind of people that are ending their life. The other thing is, and it's very interesting, that 90% of people who are actually feeling suicidal have cried out for help. They have spoken to someone, they have asked for help, but they have not got the right kind of help they required. As simple as this one question to ask somebody, as she said, how are you? It's normally taken in the physical sense. But also another question, when someone says, I'm feeling down, I'm feeling fed up, are we trained, are we equipped to ask that question, are you feeling suicidal? Because once that question comes in, how do you deal with it? And therefore, people in the community who become first responders, in your own families, in the media, everywhere, the clergy, the teachers, the counselors, all need to be trained in basic psychological first aid and how to ask this question. And when the question comes, what do you do?
Right. Gaurav, see, the thing is, as Peter mentioned, now, if you look at one of the factors, see, the pandemic obviously was one of the factors. The first responders also not being trained. So the issue is one should also now look at, if you're looking at solutions at some point of time, has the greater society, starting with the immediate family, equipped or sensitive to handle this? What has been your experience as a professional?
I'll relate my experience as a resident working in the government setup.
Yes.
It was very, when I used to be on call as a resident, I used to get a reference saying so and so has attempted suicide or apparently has engaged in self-harm behaviors, and this used to be everyday occurrence. And as a very important point I want to highlight, for every completed suicide there is at least approximately around 10 attempted suicides. So that is the degree of penetrance of suicidal ideations which people go through.
Very important point, yes.
That's so when we go there, and when I go to the bedside, it's usually a crowded ward, hardly any privacy. We try to engage in a local level. Okay, we try to get some privacy in a private ward, and try to engage with them. But the person who is attempted or the family members always have a kind of a stigma in or a restriction in speaking out about their health. The family wouldn't want it to be wouldn't want to get on the hassle of any police inquiry. Okay, because even if section 309, it's very important to mention that over here. Decriminalization of suicidal attempts has happened now, but still that fear, that notion of a suicide attempt and the family and the stigma behind it is pretty huge.
Right.
So when I go and talk to these individuals, usually half of the time it is mostly that, oh no, it was just an accident. Okay, it is just a bottle beside my bed and I had that. Okay, and it's pretty, mind blowing that this, can happen, and people, are not free to tell their stories, because of some sort of a pressure or shame, because with suicidal attempts, you have to think of what is their follow-up. Okay, whenever I used to go there, I used to sit with them, I used to, spend time with them. Time is very essential, and after that initial, conversation, I used to always tell them to follow up, or tell the resident associate that to please kindly, after they are discharged, to send them to our institute for follow-up. And even if the family, the residents will, okay, we'll come. Because mostly these calls used to be just before discharge. Now they're physically fit. They're physically for discharge. And we used to get these calls just to whether he's fit for discharge from the hospital or not. It's just before that. And the family is already in the, with all readiness to go home now. And then, that follow-up used to never come. The follow-up to a psychiatric institute should never come, because already there's a associated stigma associated with, mental health. Yeah,
anybody going to IPHB, the word that people use,
that is the
influence has gone mad.
So that is why we have to engage, larger societies, and, institutions such as schools have done a wonderful job in, really engaging, people around the conversation of mental health and suicide. But suicide as a multifactorial, issue and has to be dealt with, very sensitive, very soft hand, as to say, to get all the players into the picture, as in the academics, the school teachers, even the law enforcement. Everyone has to be sensitized in how to converse with a person who is, struggling with thoughts. Okay, and deal with the issue very sensitively, rather than because many people feel when someone tells you about suicidal ideations, it really hits at you. Because you have a tough time in figuring out what next. You feel it more as a pressure rather than having a structured way of how to help this individual. So that system has to be in place some way or the other.
Miriam, to you I ask a deeper question, in the sense that ultimately when somebody is quote unquote mentally disturbed, I'm using a loose phrase which is used, may not be the correct term, but that is the term which is used. So and so is mentally disturbed. Okay. Now, when that kind of disturbance happens, in a household, ultimately it is your close ones are the first people to kind of notice it and address it. Okay. In your experience, do you feel that there's not enough intervention, counseling, or empathy? I think the word that one needs to use is empathy. That empathy needs to be there in the households. So how does a person who's so-called mentally disturbed get that empathy? And when that empathy is not happening at home, you need a very visionary home to ultimately get that problem out of the home and say, come to say Sangat, for instance, okay, or any other organization. So in the sense that if you could just tell us, there may be so many cases when the problem doesn't even leave the doors of the house, so how do you overcome that challenge? Because at the end of the day, when you are there to solve this or contribute to society, how do you overcome this challenge of getting that door open from outside when it is not opening from inside, and bring the problem out and take it into your doors?
Yeah, so a good question, and just like you said that there's a closed door at the family level, as Dr. Peter was saying, first it's at the individual level as well, right? That I talk, otherwise a lot of the times people put on this mask that everything's fine. So in fact, we've met a lot of students who were at shock when they heard fellow student who had died by suicide saying she was so fine, she had attended this party, there was no indicators. So that's one level of closure, right? That I don't let it even come out from myself.
That's right.
Then what you're talking about is the next level of, so even if I'm showing external indicators that something's not quite right, there are changes in my behavior, I take leave more often, I don't eat very well, I don't feel like getting out of bed, or I pass statements like what's the point of waking up, I'm not saying I want to die, or for the elderly very subtle hints like distributing their property, talking about that very often, which one just writes off as this is normal in old age.
Yes.
And so one thing is the awareness that these could be indicators of a death wish, right? Wanting to die. And there may be even like chronic physical problems. Most often in our society especially, they don't come across as I'm feeling sad or and not the emotional concerns are visible, but the physical problems. They talk of backaches and all of that. So what can families do? One is, I think it's not up to the family to always, because they don't have the resources, but organizations like us, as you say, we are putting in a lot of effort, even the government, the district mental health program, to create awareness about what can be done. And they need to know about where to go, like Dr. Peter was saying. Awareness itself is not enough. Okay, fine, I know there's something wrong, now where do I go?
Right.
And when they go to these places, the services need to be adequate so that they receive the kind of care
That's
that
correct.
they
We'll come back to it in detail. Dr. Tanvi, just exactly she stopped at a point which was going to be my next question. You see, in many, say, advanced countries where this, I wouldn't say the problem is more acute, but the response may be more robust. See, what happens is, apart from your helplines, if somebody just wants to call, in Goa, do we have a system where, a counselor is a call away? Or if you're really feeling suicidal, you give a call saying, look, I really want to end it and I can't. And so do you have professionals who are adequately trained and to take a person through, soften the person up, calm the person down, at the same time see to it that you have a very robust infrastructure where you inform other first responders to immediately rush, send a vehicle there, an ambulance, whatever, to try to get the person to to the hospital to carry on the treatment. So everything should come together, the helpline, the counselors, the 24-hour service and all that. So how far are we from that optimum infrastructure?
So to talk about we have the helpline, as you said, but we do not have a helpline as to the government strategies.
Right.
So what we can say is that we have the psychiatric emergency services, but as she said, the barrier that you have at the individual level to get the patient out of that closed door, that itself takes a lot of time.
No, I'm saying suppose to you, we've traversed that journey.
Yeah.
I'm saying suppose we get to a person who's unique and ready to say, like, call up and say, look, I need help.
Okay.
Or I'm feeling suicidal. Talk me through it. Suppose there's somebody who understands that he's feeling suicidal and yet she wants to get out of it.
So the emergency services, whether we have it or not. So we have emergency services at both the district hospitals.
Right.
We have emergency services at the tertiary care institute, that is IPHB that we have.
No, it's at 3 o'clock. We have this phrase called the 3 o'clock friend. Normally at 3 o'clock when we are really depressed, we have somebody to call at 3 o'clock and have a great conversation. So do you have 3 o'clock friends within the government?
Within the government, I would say that we have emergency services which are available. If you reach at the emergency service, there will be a psychiatrist who will come and see you.
Right.
But yeah, the number of counselors, as we said, the treatment gap is a lot.
Right.
We don't have the adequate number of people. We don't have trained individuals who are there. Adequate number we are not having. The treatment gap is definitely there,
Right.
because of which the counselors and everyone won't be available at that point of time. But emergency services are there.
Okay. Rohan, I'll ask you the same question.
Yes.
If you can just respond to exactly what I asked her and respond. And
See,
then we go for a break.
my gut feeling is that we do not have the services that Goa needs.
Yes.
Because there are two things. We have been looking at the cases that are being reported. Huge amount of working class and migrant sections. Now, if you look at what is happening to them, they are not people who call the Kuj helpline, for example,
Right.
or they will not even call up the primary health center.
Right.
Now, in the last, before COVID and post-COVID, this is one group of people. The second thing which I feel is that being a tourism state, they are not looking at what are the needs of the tourists who come here. And that's what I want to point out, that there is this concept of suicide tourism. And Goa as a destination, international tourism destination, we need to be clear and watchful of this kind of scenario, that when this happens in the state, how are we able to respond? And that's why we feel today every village panchayat has to start discussing this.
Right.
Because if the budget, if the personnel, if the facilities are going to increase, then it has to become a statewide discussion which says mental health is the need of the hour, and this kind of money and this kind of professionals need to be put to that.
You see that, the majority of the suicides that happen, and please correct me if I'm wrong, either it is by consuming poison or drowning or hanging. I may be wrong, but I'm laying the premise, and it can be. Now the point here is, a lot of people say that, look, one is of course is your prevention. Secondly, when these things are happen, can we have deterrence to see that there's no easy availability of Ratol, for instance? Okay. Then if people are jumping off bridges, you need to ensure that you have railings and you don't do it, and so on and so forth. That does not kind of belittle the seriousness of what needs to be done before. But I'm just saying that when this happens, is there more that we can do, or is it an issue that is being overrated?
See, I'm of the opinion that all the agencies have not been sensitized enough. In the sense now, we are doing this campaign for 1 year from now with all the newly elected panchayat members. We want to flag this issue to them, saying that, look, at your panchayat level, what is your understanding of the problem? Are you willing to at least allocate one Gram Sabha meeting or one fortnightly meeting where you will allow a resource person to come and brief you on the subject? Point number one. Second thing is to okay, if these are the things, it's let's say we are talking about a farming area. We are talking about Sangye or Kankon where farming and pesticides are available.
Yes.
The question here is that what are the steps? Like if this thing is freely available, not properly stored, we are going to identify with the agriculture department and other agencies to put on their website what is to be done.
Right.
So the key point here is that agencies who have not yet, like municipal councils, for example, have not tied up with urban health centers.
They have not. No.
To run a awareness program.
Right.
So this is what we are pushing for from a citizen's point of view this year.
Dr. Tanvi, in your experience, do you see that the majority of the cases that come to you are cases of poison-induced suicides?
Yes,
And if that is the case, then is there any coordination that you need to have with other agencies to see that there is some deterrent there? Not taking nothing away from the other part where you need to counsel, where you need to have an environment of relative quiet. But here in this particular case, are you aware that this Ratol or whatever the poison substances are coming into play in many cases? And what are you all doing about it?
It is coming to play in most of the cases, but currently that part is not working, wherein we have stopped the Ratol being sold and all that.
You stopped it. There is a notification. You've not done it. I mean, government has not yet done it. Okay. But have you all kind of at any level discussed this, mentioned this, spoken about it? Have you all flagged it? Most importantly, have you said that, look, this is something that we need to look at? Has that, not you personally, but the system?
The system has spoken about it, but I'm not very much aware whether it has reached to the level where it will be stopped or not.
Okay. Miriam, do you see a trend in the tools of suicide, the manners of suicide? Is there something that you can again point a finger to, and how do you handle it?
Again, we don't have sufficient data to say that conclusively, but you're right in the means that you mentioned. Those are typically, if you see pan-India, the means that people use to die by suicide. But with regard to your other question that you were asking them about what can be done, I look at this problem more at a multi-level perspective. There are things that you can do at an individual level. There are things that you can do at a society, at the organizational, for example, in the workplace culture, and there are things that you can do policy level. Now, the question that you were raising earlier about bans on certain pesticides and things that people commonly use, this has been done in other countries, so we don't need to reinvent the wheel.
Right.
This has been tested through research studies and found, like for example in Sri Lanka, over a span of 10 years, where the government banned certain pesticides that had high toxicity.
Right.
So you can still use pesticides, but you reduce the chances of the person dying, and that reduced the suicides by almost half the numbers.
There is empirical evidence.
There is empirical evidence, and similarly in India, in Mehsana, Gujarat, there is a study currently where they are using a different model where all the pesticides in the village are stored in certain storehouses. So they are locked, so that, like Dr. Gaurav was saying earlier, the typically women who are experiencing domestic or sexual violence report this, that I just found it lying in the house, I thought it was cough syrup or something like that.
Right.
So these things can be avoided because they don't have direct access in that moment. As Dr. Peter was saying, that suddenly sometimes it's an impulsive thought, but it can be avoided if your access to means is delayed. And this is not an individual level effort that a psychiatrist at the district mental health program can initiate. It needs to come from the top down, so the policy makers at their level. Now, why don't policy makers do this. There are issues there with which I think all of us have a lot in the community have come across as well, where people believe those who want to die by suicide, there is nothing you can do to prevent them, and that mindset needs to change, because suicide is a highly preventable problem, as all of these studies, this empirical evidence has shown. Simple strategies like these which I just mentioned can reduce suicides greatly.
Dr. Gaurav, the same question, I mean, if we are looking at Ratol, for instance, as one of the things, it could even be overdose of sleeping pills, it could be an overdose of anything. That is one aspect I'd like to respond to. Another issue I'd like to pinpoint and flag is drinking and, excessive drinking and alcoholism. How much has that also been a trigger in your experience?
You've raised a very poignant issue, because when we are in the state of Goa, it goes without saying that alcohol consumption is pretty prevalent in our state, and alcohol and a mix of other societal problems, environmental problems, multiply the risk of suicide behavior. Why is that? The thing is that we have to understand that alcohol disinhibits your inhibitions at times,
right?
And and also people at times have to understand what is their understanding of what alcohol will do to them,
right?
Will it cause pain to reduce? Will it cause anxiety to reduce? What is there? That is a very nonsensical of thinking that it will reduce my hardship, it will reduce my pain,
right?
It will reduce my suffering,
right?
And then in return it just bites you at the back.
Right.
It causes further aggravation. Alcohol does not only harm the individual; it harms the family. Okay, and it's seen that people who are using substances and also have certain traits in them of impulsivity tend to carry out the act much easily, carry out the ideations of suicide much easily, because in turn they have alcohol with the feeling that it will reduce the pain of carrying out some act. So that itself can trigger your ideations to a planning level. So that
and you've seen this in cases?
Yes, in various cases wherein the person who I'm interviewing has had issues of alcohol for a long time, and it's mostly alcohol which is had in a very in a manner which it had to intoxicate yourself.
Right.
Quick consumption of alcohol for the purpose of being intoxicated, that is what is very harmful.
Yes.
Okay,
yes.
like a quick break. Okay, you're working day and night, weekend binge of alcohol wherein the person tends to consume to the state of intoxication. That is the risk factor which you've got to prevent. And another factor about overdose. Now talking about rectal poisoning, I have seen more overdoses than rectal poisonings, personal experience, and we as clinicians have got to take the responsibility of really judiciously giving medications out, and when we have to psycho-educate the public and our patients adequately as to the
and chemists and pharmacists as well.
Yes, that is also another player. They have to sometimes even you see people going to the pharmacist and just, I don't get sleep for some day, just give me some medication, and sometimes they even give. But I've seen many pharmacists across.
And you can't do that abroad. Abroad is very difficult.
It is very difficult. In Goa we have a good restriction on that, and I've seen pharmacists really asking for the prescription by a doctor, the recent one. But sometimes
that is an exception rather than the norm.
That is an exception rather than the norm. So definitely.
Dr. Peter, two quick questions. One question to end this round, another question to start the next round. Now, here somebody touched upon, one of the panelists touched upon domestic violence. I think one of you also touched upon domestic violence. Now, the issue is, what is the correlation between domestic violence and suicides in terms of trends that you all have seen, and have you addressed this factor?
So, before I come to this, can I just, because I'm really itching to answer this question, when you're talking about access to means, and in fact there is a law already. There is the regulation of the sale of poisons, the Goa Sale of Poisons Act, and there is already a law in place, but the implementation of the law is not fully there, and therefore it's very important that there is a restriction of the sale of pesticides as well as pharmaceutical products.
Right.
We have seen students wearing their uniform.
Yes.
I mean, there was a case in North Goa. A student wearing her uniform goes to a shop, buys the pesticide, goes to a place on the side, spreads it on the bread and eats it. But the thing is, how did that person actually sell it to her? He had no right to sell because she was first of all in uniform. She's underage, so below 18.
This is a case study. This is a case.
It's a case. It was reported by the media all over.
Right.
So you cannot sell certain substances to minors, to those below 18, because we already know that they are highly impulsive. So if the law is just implemented, I think a lot of these problems will automatically take care of itself, and therefore we are stuck at that implementation level. Number one. Number two, we're looking at pesticides and rodenticides, but we're also looking at jumping from bridges as one
Yes.
of the thoughts that come in.
Yes.
And the learnings globally is that if you do simple measures like maybe railing the bridge or patrolling the bridge, putting CCTV cameras, preventing pedestrians from walking on a bridge, or preventing people to stop on the bridges, simple measures like this can actually reduce the rate of suicide. We've seen it. The Golden Gate Bridge right now is being railed. They're spending more than $250 million to do that, to save 30 lives every year. To save 30 lives, they are spending this much of money. Number two, we've seen it in our very own Goa, where after we completed the Yellow Ponda project, the Bori Bridge, which was a hotspot for suicide, they railed it. With simple railing, they didn't spend great money.
Right.
But that has reduced the rate of suicide in the Bori area to zero, which was a hotspot.
Right.
I'm really I've been writing so many letters to the government to raise to rail or do some measures with the Mandavi Bridge, because that is another automatic thought that people have.
Right,
If you
absolutely.
ask people who are thinking of suicide, how do you contemplate to do it? Many of them do think of the Mandavi.
Right.
Many of them do think of the Zuari.
Right.
And therefore, simple things like somehow the Atul Setu has already, I feel, has got some measures. I really don't know whether
They don't allow pedestrians.
they don't allow pedestrians.
Right.
Exactly. So these simple measures can be even adopted on the other bridges of Goa. We can reduce the rate of suicide drastically using jumping from bridges.
Right. The other aspect that I wanted to quickly touch upon before going into the whole aspect of media and communication,
Yeah,
because
yeah,
I
yeah.
want to address that quickly. Quick thing on the correlation between domestic violence in this. Quick.
So, domestic violence is definitely is a huge cause of stress within a person, and as we have seen, data from India shows that almost 50% of suicides are non-medical. They are due to social, cultural, relationship issues,
Right.
and that's where domestic violence does come in. And domestic violence can be both, can be physical, overt, and can be very silent and emotional abuse. And that, if people are not able to come out and seek help, can lead to the stress just leading on, and is definitely a correlate for suicide. Yes.
One issue that we normally don't look at often enough is to look at ourselves in the media, as it were, because I think the media also does play a very, very important part in communication, awareness, and also being sensitive to the manner in which you are kind of reporting cases, and that has been raised by many people. So I'll take this opportunity to have a quick round on how can our communication be better, how can we as media people do better, where are we lacking, what do we need to do, what do reporters need to do to be more sensitive, and how should editors and people who are in charge of organizations, what changes do they need to make in the manner you report it, the way you report it, and so on and so forth.
So we know this media does play a huge role.
Yes.
It's how you report it, and how, like we know that certain means of suicide in Goa especially was promoted by the media,
Right.
and it was promoted because it was sensational news at that particular point in time. But that has stuck in the minds of people, and today as soon as they think of suicide, that means pops up immediately in their minds. So we need to be very sensitive when it's important that every suicide is reported sensitively. We need to understand that there are many nuances around a suicide.
Right.
At the face value, we can say, okay, the person failed his exams and therefore he ended his life. But that may not be the true reason.
Right.
There may be multiple reasons leading to his failure also, and then we cannot say that failure has led to his suicide or the parents have been bad parents. There are many issues which we really do not know, and that's where the role of psychological autopsies come in. So since we do not know, let us not put it out there what we do not know. Number one, let us not report suicide sensationally. Let's put it in the 3rd page, 4th page, right down in one corner and say, let's not give details of the person. We know that it is very traumatic for the family, and then all the details are being given on the newspaper, which becomes even more traumatic.
So you're
that
saying
it's
that,
out there.
that lower the detailing and bring it
Lower
down.
the detailing.
Right,
Lower the
right.
detailing. Do not give out information. Use that suicide now to educate
Like if
people.
the mother has ended the life of her own child, don't sensationalize it.
Don't sensationalize
Right.
it.
Yes,
Don't.
correct.
Absolutely not. Because then you're giving ideas to others, and the trauma to the family increases, and putting him at risk for suicide now. Because we know that after a suicide in the family, the other members that were close to that person are at risk. So we are putting other people at risk of suicide if we give too much of information.
But we're looking at communication. How can communication be much better? How can kind of we, not just we in the media, but others who are in the larger media, which is now the social media, which has taken over traditional media completely in many ways. So if you can just address a little bit on what even the non-conventional media can do or not do.
So that's where the youngsters of today's generation get most of the news from.
Yes.
When we browse through various Facebook pages, Instagrams, say a news pops up, and say a media has reported the issue very sensitively. Okay, it shows non-specific pictures and very generic ways of how to sensitively report the issue.
Right.
What happens after that? People comment, right? And the youth and the people usually look at those comments in a very intriguing manner.
Right.
Okay, what is really said, and people make judgments very easily. And it's open platform, so judgments are formed pretty easily. And there should be some sort of a self-control in how you revere a situation. Okay, a simple RIP or something will be more than enough. Okay, and maybe a person who's really involved with that family can go visit them rather than commenting or commenting on any news media. Visit them and just show their condolences and give them time
Correct.
to really vent out. And as Peter said, specifics need not be mentioned. Okay, it's not really important to understand the means. You have to understand this as a multi-dimensional aspect of suicide, and providing more educational information and means to seek help will go a long way in helping another person who is on the brink.
Right.
That will be much helpful.
What can families do to ensure that this impact of suicides is lessened in terms of, see, what happens is very often people get to know that person has committed suicide primarily because the family goes and says so or does not say so. It depends. How can families do better to see that the impact of this is lessened and the dissemination of that information is restricted and responsible?
So you mean after the suicide
Yes,
has happened,
after- yes.
how should the family
Yes,
respond?
yes.
The thing is, putting the onus on the family is unfair, right?
No,
Because
without
they'll-
putting the onus, I'm just seeking advice.
like what would be helpful for
Yes,
the
that's
family
right.
and
That's
that.
absolutely.
I think that's a society and collective response for us to help the family.
Sure.
Like someone was saying earlier, for every suicide there are 10 or 15 even other attempts. It affects other people, right? It's like a ripple effect. What can we do? Of course, families can look out for each other. There needs to be post-vention plans. Like I'm sure there must be organizations at their level, but maybe at a government level where if there a suicide does occur, like Dr. Gaurav was mentioning, there is no follow-up of that family. If an attempt also occurs, people who attempt suicide are more likely to die by suicide later.
Right.
So these sort of follow-ups need to happen, not just with the individual, with their families as well. I also want to add something on the media reporting, very practical things.
Sure.
There is a whole guideline by WHO, so editorial houses can train their, if not the reporters, at least the copy editors. The other bit is that since suicide used to be a criminal offense, we still are in that sort of shadow where crime reporters are assigned with the task of reporting
That's a very
suicide.
important point,
So then
yes.
that influences the language with which
Right,
it's reported
right.
still as a crime. Not showing pictures that would
Would help. No,
and
sure.
some papers have even done this, where have shown that if they describe the circumstances which led to the suicide, they describe alternate healthy ways that the person could have dealt with that
Sure,
situation.
sure. Very important point, yes.
Followed by helpline numbers. So
Right.
you're giving people alternatives and access to resources.
Dr. Tanvi, will it also help, just a quick thought I had, that when a case like this happens, and if suicide does happen, and when police get involved, can you all work a little more closely with the police and say that, look, it might help if the PI or the IO doesn't normally say, oh, this person died of suicide. See, very often what happens is, if you see even unnatural deaths that are happening, especially in the tourist belt, whenever a death is happening, to prevent it being described as an overdose of drugs or any other case or even a murder, the first thing they say is suicide. As if, when you describe a case as a suicide case, then all other cases that you want to bury, so suicide is a soft target. Now that shows extreme insensitivity on the part of the police. So your quick response to this.
So you're saying that we should be working along with the
police, as a government agency, to say, look, whenever a crime happens, don't immediately jump and say it's a suicide. You are not jumping immediately to say it's a murder. To save your records and to avoid getting into a murder investigation, your first response is, it's not a murder, it's a suicide. Now, suppose it is not, then the stigma on that family is also, the stigma and the trauma is also huge.
That is huge. Yes. That is true. So I think for that, awareness has to be created maybe in the law and enforcement itself. We have to make them aware about, how things happen regarding suicide, what are the different factors that are associated, and make them aware about the different stigma that is there, and make them aware about how we can work with along with the government setup, how the institution basically can help in terms of that. At the institutional level, what are the things we can do?
Okay. Roland, quick 20 seconds because running out of time. 20 seconds on your solution plan.
Yeah.
I'll do a 20-second round with everybody.
Yeah.
Just starting with you.
So the way I look at it is that this year, since the whole election process is over, we are of the opinion that public, functionaries have to get involved, and they need to put money where their mouth is.
Right.
In the sense that this is what we are going to do, and this is what we cannot do, and this is where the state government has to intervene. So very clearly, there has to be also more interaction between, as just now discussed, the police, public prosecutors, across the board, sensitization should happen. And in terms of the media, I think if more stories could be written about, the state of mental health, which are the agencies available, everything cannot be put in the form of an advertisement.
Right.
So, more write-ups like this will change.
Done. Dr. Thanvi.
When we talk about suicide prevention, we talk about different levels that we are going to see. So we look at the institutional level, the community level, and the individual level.
Right.
So we have to work maybe at the school level, making them aware about different things, the life skills that we teach them. We can create awareness by giving them coping skills, how to achieve that, the problem solving skills, the emotional regulation, how they can do that. So teaching that at the early level can actually help them understand how to go about this. And also at the institutional level, maybe a lot of things like Dr. Gaurav said, the loss to follow up is a huge gap that happens. So the uninterrupted transition care that happens from the hospital to the community. So we need to fill up that gap, maybe with help of counselors or something like that, so that the transition of care after going from the tertiary care hospital to the community has to be seen.
Very important. Miriam, your last.
Yes, so they've spoken about the systemic level changes. I'd like to highlight a bit about the individual level changes as well. One thing I think we could all prepare for is that we are all at some point going to experience some despair in our life. Like she said, really from a young age, equip children that this is going to happen. And when you experience that despair, and if you do, it is another thing is to really normalize that people it's very common that people get thoughts at wanting to die and wishing for life to end, and not stigmatizing that thought itself, so that people will verbalize that thought. So that's at an individual level where we train people. And then at a community level, I would feel busting a lot of myths, like for example that people who die by suicide, there is nothing that we can do to prevent it. That sort of, those myths need to be busted, that there is a lot that we can do. Every suicide is preventable.
It's preventable, very important. Good takeaway. Dr. Gaurav.
Yes. Regarding one important theory which I came across, the interpersonal theory of suicide. What it says is just two very poignant aspects: deficit in belongingness and burdensomeness. These two factors play a major role in pushing a person to the side. So our social connections, our social foundations have to be strengthened, ever so more so now. And the kind of burdensomeness a person feels has to be reduced by collectively by the society. And suicide prevention, as said earlier, sometimes the government agencies don't pay much heed because maybe their aim is zero suicide.
Right.
That can't be a realistic aim, right? So we have have to aim at reducing the number of suicide and bringing the happiness index above.
Very important.
Okay,
Absolutely.
that is what a social belongingness, a social fabric has to be created in such a way that all the parties work together in creating the sense of social integration, which helps in building that sense of collective unity in us.
Dr. Peter, your last words on the subject.
So for me, I accept what everyone says, but we'll all speak on it at an individual level. At an individual level, it depends on each department to start thinking, and unless they kind of work together, it's not going to happen. What I'm driving for is a Goa state suicide prevention policy, where you'll have stakeholders from every department on one platform, and together we think this through. Because if we do not think of it from a suicide prevention mindset, we're all going to be doing very haphazard individualistic work.
Right.
So how we approach HIV/AIDS, we have GSACs. We need to approach suicide prevention in the same way, where we get all stakeholders together, be it from the media, be it from the PWD, be it from the health department, social welfare department, education, law enforcement, everyone together, and that is my take.
And the people at large.
And the people at large.
I
Yes.
thank all my panelists for a very, very riveting discussion. I'll just close by a couple of quick thoughts. I think the most important takeaway from our discussion is that everybody, irrespective of whether they've had such thoughts or not, should understand that you're not alone. Your family, your society, other institutions, there are well-meaning people who are all there as a larger support system. You only need to tap into it, or we will work harder and harder to make sure that the system taps into your problems, your issues, your traumas, to see to it that we become a society that is not just successful or rich or economically powerful, but just happy. And I think that's the wealth of happiness is something that we don't talk about much, but ultimately it becomes a life or death situation. And I think here's to life, and here's to an effort, a collective effort to ensure that we do not lose lives that are highly precious and can be saved. And on this note, let us observe this period a little more collectively with a lot of thought, and to ensure that we bring down those numbers and make Goa a happier place to live in. Thank you.